everyone, it's me, Miss Medicine, and today we are going to be discussing pregnancy tests. Pregnancy test detects the pregnancy hormone HCG, human chorionic gonadotropin. This is the hormone that keeps the pregnancy going and allows it to develop and grow into a full-term baby most of the time. Now, if you need to know when to pick up a pregnancy test, most of the time, if I were you, I would wait until your missed period to go and get a pregnancy test. But sometimes the box will say 6, 5, 4, how many days sooner, and that's how many days sooner you can take it with getting a positive. Not all women will detect a pregnancy at that time, though. Everyone is different. And when you're having the symptoms like nausea, vomiting, morning sickness, fatigue, enlarged breast, all that jazz, that's when you definitely want to go get a pregnancy test to make sure. Let's discuss Clearblue pregnancy test. I'm going to draw a pregnancy test to show you the basics. This is what a pregnancy test looks like. Now, let's say this is a Clearblue pregnancy test. This digital pregnancy, one of these pregnancy tests is a digital one, and it'll say in words, pregnant or not pregnant. All you do is use your urine stream to pee onto the absorbent tip or collect it into a clean, dry container. And then you let your pregnancy test load. Each one will have 4 bars detecting the time. And then we'll count down to your result. If your result is pregnant, see your doctor, who can advise you on your next steps, just like every pregnancy test. But like every pregnancy test, if your result is not pregnant, but you suspect you are pregnant, wait a few days before testing. Or if you're very concerned, see or talk to your doctor. And that is how a digital Clearblue pregnancy test works. Now let's discuss an early detection pregnancy test. This one is an analog pregnancy test. That means it doesn't say it in words, and it doesn't have a battery. This one has dye. Again, either pee onto the absorbent tip or collect it in a clean, dry container for about 5 seconds. Or no, wait, 20 seconds. I don't know, but still. And it'll go to your result. Each pregnancy test has a little control window like this one. If a line does not appear in that window, the test did not work. Again, if you have like a problem with your pregnancy test, which you may have problems with your pregnancy test, but we'll get to that later. Now, if your result is pregnant, you will have a plus sign in the window. This one right here is a control line, and the vertical one is a test line. If you have a plus sign in your pregnancy test, your result is pregnant. But if you don't have that, if you just have a horizontal line in that window, you are not pregnant. And that is a Clearblue pregnancy test. I don't know if there's any more Clearblue, but now let's go on to first response. First response is kind of like Clearblue. It has a digital test as well. So let's start with that. Now, this is what without the cap, this is what a first response digital pregnancy test looks like. Either pee onto the absorbent tip or collect it in a cup. A little clock symbol will appear on the pregnancy test flashing when it starts working, and will count down to your result. If your pregnancy test result says yes with a little plus sign on it, you're pregnant. And if it says no with a little negative sign like this, then you're not pregnant. Now let's go on to our first response rapid result pregnancy test. First response rapid result pregnancy test looks like this. Either pee on it like every pregnancy test or dip it into a cup. This one has lines. It'll either have 2 lines for pregnant or 1 for not pregnant. This pregnancy test can be as fast as 1 minute. Now when you pee onto the absorbent tip, you only pee on it for about 5 seconds. But when you dip it into the cup, you dip it in for 20 seconds and then wait for your pregnancy test result. If I forgot to mention that the control line is also known as the test, the line that shows if you're not pregnant. Without the test line, it's not pregnant. Let's say this is the test line and this is the control line, right? If you have both of those, you're pregnant. But if you just have one line, you are not pregnant. Now let's do early result. It's the same one. But this one takes about 2 minutes, 3 minutes. But you should not wait, with any pregnancy test, you should not wait longer than 10, as this can lead to result error. This one takes a bit longer. Again, if you have 2 lines, you're pregnant. But if you have 1 line, you're not pregnant. Or it may just be too early. But we'll get to that later. All right. So that is first response pregnancy test. We're going to move on to EPT pregnancy test. EPT stands for error-proof test. Now let's start with the EPT digital pregnancy test. It's like Clearblue. It says it in words. Without the cap, the test looks like this. Either pee onto your absorbent tip or collect it in a clean, dry container. And then it'll count down to your result. And it'll say pregnant or not pregnant. Like that. It's as simple as that. Now, I don't exactly know what the analog EPT pregnancy test looks like, but it looks something like this. I think if it looks like this, you're pregnant, but if it's like this, you're not pregnant? I don't know. You'd have to see the actual EPT test for yourself, so don't blame me. I'm not a real doctor yet, and that is a disclaimer for you. This is just educational information. You might have seen that at the beginning of the video. Now let's go on to like a drugstore pregnancy test. Generic brand. Now let's do something like this. This is like CVS Health pregnancy test. We're going to do the CVS Health digital pregnancy test. It'll either say pregnant or not pregnant on it, I'm pretty sure. Or yes or no. That's what it looks like. But let's do an analog pregnancy test. CVS Health analog pregnancy test looks like this. Here is the test window and here's the control window. If you have, again, pee on the test stick or dip into the water. I mean, pee. If you have 2 lines, your result is pregnant. If you just have 1, you're not pregnant. And same for pretty much every other analog pregnancy test out there. Now, looking at your results can be kind of tough with some tests. Like, let's use a first response for our example. Like, for example, this, let's say this is the control line, but this is the test line, like that. I can't really draw a faint line, but let's say that's the test line. The test line can be very faint, as it may make it very hard to read the result. But it can sometimes be as clear as day that you're not pregnant, like that. You just never know. Now we're going to talk about errors. Pregnancy test errors can happen at any time. It may have happened from holding it up or diluting the urine. But let's talk about a dye run. Let's say this is a first response test. Again, first response, I'm not making fun of you. I'm explaining to people here. Don't get me wrong. But let's just say you had like a control line and then like a little smudgy kind of thing, something like that. Then if you have any errors like that on an analog test, retest with a different test for sure, as this is a very faulty pregnancy test. Sorry, first response. Let's talk about errors with digital pregnancy tests. Like, let's say Clearblue. Sorry, Clearblue. Let's say a Clearblue digital pregnancy test had an error. It would show a little book symbol like this. with an arrow pointing in. That would mean to see the little booklet results for your next steps, as you did not use the pregnancy test correctly. And with first response, it would show a question mark. Sorry again. Now let's talk about false negatives. If you're trying to get pregnant, false negatives can be really discouraging. For this example, I'm going to use a generic drugstore pregnancy test. Let's say that it's negative, but you're actually pregnant. That is called a false negative. False negative may be due to the fact that it is too early in the pregnancy to detect the hormone, HCG, or it may just be a faulty test. You never know until you find out. And then false positives, however, sorry, I didn't mean to erase that. False positives, however, is when you get a positive result like this, but you're not actually pregnant. That, or you may have lost the pregnancy very early on. This can be devastating to a pregnant woman. And this is what's known as a miscarriage, if you guys don't know already. Miscarriage is a very devastating thing, but we will get to that in another video. And so yeah, that is our pregnancy test video, guys. I hope you enjoyed it. And again, I am Miss Medicine. Comment, like, subscribe, do all that jazz. Anyway, thank you for watching. Bye!